Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Does Clobetasol cause hair loss or growth? Clobetasol can stimulate hair growth. Regrowth may be noticed as early as 6 weeks into treatment but may take up to 12 to 14 weeks to occur. In some people, hair regrowth does not persist long term. Clobetasol should only be used for hair loss associated with inflammatory conditions of the scalp such as alopecia areata, scarring alopecia, psoriasis, eczema, or dermatitis. Hair loss or hair thinning may also occur, but this is a very rare side effect and is estimated to occur in only 1 out of every 300 people who use Clobetasol. Clobetasol is a potent topical steroid and is not a good option for hair and scalp conditions that are not associated with inflammation. In one study, 28 patients with alopecia areata totalis, alopecia universalis applied 2.5 grams of Clobetasol propionate 0.05% ointment to the right side of their scalp every night and covered it with plastic film. This was undertaken 6 days a week for 6 months. 8 patients, 28.5%, experienced hair regrowth which began 6 to 14 weeks after the start of treatment. But hair loss was maintained in only 5 patients, 17.8%, long term. In another study of 34 patients who used Clobetasol foam to treat moderate to severe alopecia areata, 89% of people reported hair regrowth compared to 11% of those using a placebo foam. 14 patients had hair regrowth of more than 25%, 7 people reported a hair regrowth of greater than 50%, and 3 people reported a hair regrowth of greater than 75%. The foam was applied twice a day for 5 days per week for 12 weeks, then continued with the treatment if they wanted to up until 24 weeks. Overall, 47% of patients had hair regrowth of greater than 25% after 24 weeks. RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.